Greetings, Untamed television fans. Thanks for joining us. I'm Craig Bielik, your host, the guy that you probably see way too much. But that's okay. You don't have to put up with me much today because I have a great guest with me. I'm joined with, I guess I should say, Rob Malan. And Rob is a physical therapist.
Yeah.
Currently employed at Mountain Star Orthopedic and Sports Therapy.
Yep.
Did I get that right?
You got it.
I have to get that right.
Yeah,
right?
You got it. Yep.
Very good. Very good. How long have you been a sports therapist?
I've been doing this for about 14 years now.
Really?
Mm-hmm.
Really? And it's a job you like?
Yeah, no, I love it. Yeah, I'm passionate about it, and it's been great. Yeah, I've loved working there, and it's been, I mean, you learn a ton while you're doing it. You get to work with people, so it's a great job. Yeah.
Right, and I imagine that most of the people watching at home right now are going, well, what exactly is physical therapy? I mean, I kind of know because one time I hurt my elbow or whatever, but what does it all encompass?
Yeah. Physical therapists are experts in evaluating and treating any kind of, our specialty is in orthopedic medicine. So if we have any kind of injury with the joints especially, we specialize in that. But it's all about getting people back to doing stuff they want to do. So if it's a back injury and it's keeping you out of whatever sport you like or activity you like doing, and then we just work on getting you back to that. And that might involve different, first an evaluation, but then also different treatment techniques that are used to get you back to doing that, whether it's working on range of motion or strengthening or exercise or whatever it might be.
All of those sorts of things. I have some experience. I injured my back a few years ago. Went through about 8 weeks of physical therapy, and they taught me stretching exercises, things like that. One of the things I didn't realize was, it was my back, but they were like, you've got to build the muscles around it, like in your glutes and things like that. I mean, something that I never could have done myself, and that's why you guys exist.
Yeah.
What's the most common injury you see?
Really, we see a ton of injuries involving the spine is really common. We get low back injuries, neck injuries are really common, but we see a ton of just anything from post-surgical patients who've had a knee surgery or shoulder surgery or that sort of thing, to foot and ankle, to just tendonitis or ACL injuries with athletes. So we treat, the nice thing about our facility is we see people who are anywhere from little babies sometimes as small as little infants who have neck problems, to all the way up to people in their 90s.
No kidding.
Yeah.
Do you treat cats?
No.
I just want to know because seriously, a couple of days ago, one of my friends took his cat to the vet, and the vet said, "Well, your cat has basically a sports injury."
Yeah.
And I had never heard that term in my life for cats. A sports injury.
I think there's a market for it, but I'm not interested. I'm sure there is.
So, what is a sports injury then? I mean, I think a lot of people say, "Well, I don't play sports, so I don't have a sports injury."
Well, really, anything that happens during athletics, and the reason athletes are a little bit different than the average person is a lot of times they're in the middle of their season, and we're trying to get them back to their sport, which is usually super important to them, right? They want to get back as quick as possible. So it can be anything from you twisted your ankle while you're out on the football field or soccer field or something like that, to an overuse injury of tendonitis in a basketball player, for example. They get, a lot of times they'll get knee problems from tendonitis from doing too much jumping or that kind of stuff. So those are usually what we typically classify as sports-related injuries, overuse injuries or acute injuries where they've actually gotten taken out or had an event happen that caused them to be out of their sport.
Right. So the process is like, let's say my elbow is killing me and I can't move it, and all of that kind of stuff. I don't call a physical therapist, right? I go through a family doctor and then maybe an orthopedist, and they do a referral. Is that correct?
Yeah, pretty much. We've got in Utah we have direct access, but our facility does require a physician script. Direct access is where you could just call the clinic and go anytime, but because we're part of an organization that requires a physician referral, then we do encourage people to go to, they can go to their family doctor, they can go to an orthopedist. If it's a major injury, we usually recommend that they go and have some x-rays and a workup done with an orthopedist who specializes in that area, whether it's their foot or ankle or back or whatever it might be. And then once they have that referral, they can call, make an appointment, get in, and we'll take care of them from there.
So, and the first step with you guys is you do an evaluation of the person, and you ask questions about lifestyle and Are you a NFL player with an elbow, or are you a gardener? I mean,
Sure.
How do you walk me through kind of how that will happen?
Yeah, so normally what we'll do is we'll have someone come in for their first appointment. We usually set aside about an hour and a half for that first appointment if it's something that's more than just a real basic, post-surgical evaluation. And that gives us time to sit down with the patient, go through their medical history, and do a real careful examination where we do a lot of different tests and measurements and things like that to really figure out what's going on with their problem. If it's an overuse injury, there's usually something that leads up to it, whether it's tightness somewhere or the way they're jumping and landing, or any of those sorts of things. Maybe a weakness in their muscles or that kind of thing, like you talked about. And once we've established that, then we design a treatment plan for them and start them that day on treatment. Whether that's, if exercise is needed, then we use exercise, or if it's manual therapy treatments that are needed, then we'll do those.
And that's adjusting, like adjusting spine. Is that what you mean by like manual treatment, or
right?
What does that actually
So
mean?
there are some. We use what we call joint mobilizations a lot of times, soft tissue techniques where they might get in with a device and kind of rough that tissue up to create a healing response. And those are all considered manual techniques. Anything where you're putting your hands on your patient and you're mobilizing joints or stretching or doing those soft tissue techniques is what we call them.
Wow.
Yeah.
Wow, is there anything you guys specialize in at your particular shop?
Yeah, no, thanks for asking. We one thing that we've all tried to find little niches of things that we're interested in. And one of the things we specialize at our clinic at is running evaluations. There's one big thing that we do a lot of. For example, if you had let's say you're training for the Ogden Marathon or something like that. And
I definitely am.
Yeah, which I know you're all about.
Just look at me.
So they, if you develop knee pain in your training and you weren't, and you're signed up for the race, that's what's so hard with these people is usually they've got something they really want to do, whether it's a marathon or a half marathon. They've signed up, they've got their friends involved, and they've started to get some knee pain or something. And so what we would do is bring them in for a really comprehensive physical therapy evaluation. And once we've tested all their strength and flexibility, range of motion, all of those things, then we would do a video analysis where we get them on the treadmill and use high-speed camera and video them in slow motion and look at all the different aspects of their running, how they're striding, how they're landing on their foot, what kind of alignment they're holding when they're running, and all these things that can contribute to knee pain. I mean, what the patient doesn't really care that much. They care that my knee hurts and they want to get it better. And so then once we've got that down, we can see, and the thing I like about it is we can actually show them on the video, hey, this is what you're doing when you're running. Can you see? And then they buy in, and they're a lot more dedicated to their home program that way.
That's interesting. I think most people think of physical therapy, it's going to be the manual stuff.
Yeah.
And my experience again was it was more education. How to strengthen muscles, exercises to do that, how to lift something, to keep your back, and how to stretch your back out, that kind of stuff. There was some manual application also, but overall it was just, and I still do those exercises. I can show them to you.
Yeah, that's great.
I can show them to you. Some of them look like yoga, but
I always feel like if you can teach people what to do, that they can continue doing that for the rest of their life, or they can, if you can teach them how to fix their own problems, then they're empowered and they can go out, and if they start feeling it coming on, sometimes they go back and they go, hey, I remember you taught me how to do these 8 things here, and if I do those again, things go well for me.
Wow.
So that's one of the fun parts of the job, is educating people too.
Absolutely. He's a smart guy. I mean, listen to this guy. He's a smart guy, and people will want to know more, and of course they'll want to know more. So, website, how can people find you?
Yeah, so if you just go under BrighamCityHospital.com on Brigham City Hospital's website, and then on there's some links to the physical therapy services, and you'll see our website there.
Okay.
It's got a little bio on the therapist, and then our contact information as well.
Okay.
So.
And how many therapists you have there on staff?
Yeah, so right now we have 3 full-time, and we just hired another one. So we have 4 full-time PTs, and then 2 PT assistants, and then several PT aides that work in and out of the clinic.
So good. So a good staff.
Good,
Good sized staff. And so if you're out there and you call, It won't hurt Rob's feelings if you say, you know what, I could see Rob or one of your other staff people. You're a tough guy.
Yeah, no,
you're a tough guy. It will not it won't hurt his feelings.
We've got Darren.
You should ask for him.
We've got Darren and Kevin and Randy that everyone has. They're excellent to work with people, and they'll take really good care of you.
Great. To end, what's the one myth about physical therapy that you'd like to dispel?
I guess that some people think physical therapy is like going just to the massage therapist or something like that. You're just going to get massage and walk in and out. But there's really so much more involved in it from an education standpoint, from learning. We're really experts in movement analysis and exercise and those sorts of things as well. We use the hands-on techniques to help accomplish what people's goals are. But I think that's one of the myths, that and then also that it has to be grueling and horrible. People,
it's a torture chamber
all the time. People go in there and say, all right, I'm ready for this, I've been warned, and then they're pleasantly surprised when we're able to work with them. My philosophy personally is if you really want somebody to do well, like after shoulder surgery or something, if you will teach them what to do and help them and push them along a little bit, then they're able to do it at home, and like I said before, empowered to do it. Whereas if you just go in there and every time you go in you just ratchet on them really hard and make them so sore they can't do anything, you're not going to get where you need to. So we really try to work with patients instead of against them, and try to dispel that myth of that it's got to be awful when you're in there, because it's not.
That's worth it alone. Just hearing that, I think, is worth it alone. If you are looking for these sorts of services, feel free to contact Rob and the whole group. Find him at brighamcityhospital.com. And again, you probably will need a referral, but they can walk you through that process too. And make sure that you get set up with a family doctor or orthopedist. And for heaven's sakes, don't be in pain. Don't sit out there with a bad elbow or a bad knee or something like that. There's ways to fix this. I mean, you can do it. Right, Rob?
Absolutely.
Rob Malan, Mountain Star Orthopedic and Sports Therapy. Craig Bielik, your host. Again, another episode of Untamed TV. And I told you I wasn't going to talk a lot. Rob did it.
Yeah. Thanks so much, Craig. Appreciate it.
You are so welcome. Thank you.
Yep.